All right. Good morning, everybody. So Josh here. I just wanted to thank you two for joining the call this morning, and also say that this call is being recorded, so that way if anybody chooses to listen to the call later, you'll have a lot of information that you can listen to and then reach directly out to Bernard after the call if you have any specific questions. But as I've mentioned on a couple of our owner calls, Bernard and Franchise Benefit Solutions have the ability to provide our franchise system and each one of y'all individual franchisees the ability to provide health benefits in a variety of different options for your team. And again, gives us another way to be a good, solid employer and keep our employees engaged, and hopefully help with our employee retention by providing some additional benefits and care to them. So Bernard is going to walk through kind of the package that he's been able to put together for the casual pint, and show some of the different options and things like that. And then he'll also have a question and answer session there at the end. If we have any questions from the folks that are joining the call, we'll be able to answer some of those questions here. And you'll also have the opportunity to review the benefits package that will come out via email after the call, and then review that, and also reach out to Bernard directly with any additional questions and things. So with that introduction, I'll go ahead and turn it over to Bernard, so that way he can walk through the benefits package for us.
Good morning, everyone. Thank you, Josh. My name again is Bernard Rubenstein, Managing Director of Franchise Benefit Solutions. I want to welcome casual pint franchisees to our Franchise Benefits Program webinar. Providing quality, affordable employee benefits is one of the most critical issues facing the franchise community today. By offering a benefits program, franchisees are better able to compete for and retain skilled and experienced employees. Many franchisees may not offer this important benefit. This may be because employee benefits are often expensive and inflexible and don't take into account the needs of many franchisees. Over the next 30 minutes, we're going to cover facts about franchise benefit solutions, biggest challenges facing franchisees, why offer benefits to your employees, our program advantages, our products portfolio, looking ahead to 2024, solutions to help you hire and retain employees, and as Josh mentioned at the end, questions or comments that you may have. With over 40 years of experience specializing in customized benefit programs to the franchise community, our firm provides exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Best Life Brands, Five Star Franchising, Valpak, Grocery Outlet, The Joint Chiropractic, and Jenny Craig, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of the changes going on, and many have expressed an interest in offering alternative benefit plans to help recruit and retain employees. What is the biggest challenge that we find facing franchisees today? Over the past several years, we have found that franchisees have challenges with hiring. Most franchisees lack the benefits to attract new employees. So I'm going to show you how to fix it. First is, why offer benefits to your employees? Let's talk about offering benefits to your employees. Employees are the heart of any great business, and key employees and leaders are essential to long-term success. Once you get a great team in place and they're performing well, it's a huge blow to lose any of your indispensable employees. Benefits are no longer a perk in today's business world. They're an expected part of compensation. Here are a few good reasons to offer benefits to your employees. First, attract and retain your best employees. By offering quality benefits, you will attract and retain qualified candidates for your business and keep your best employees happy. Increase your bottom line. By offering benefits instead of higher wages, you win by having a lower wage base match for state and federal unemployment taxes. Boost morale. By offering a benefits package, you've shown invested interest in your employees. In short, benefits can help promote good morale by keeping employees happier and healthier with less turnover for your business. Promote employee health and wellness. When employees have access to wellness, preventative care, doctor visits, and telemedicine programs, your overall business environment is healthier. Fewer employees are out on sick days, and fewer people coming in to work while ill equals increased productivity and profitability. Beat the competition in the race for talent. By offering an ACA compliant health plan and voluntary benefits, you can beat out half your competitors that do not offer benefits. And finally, create loyalty. Health insurance is an emotional offering. It says to your employees, you're a value asset to this company, and we care about your health and well-being. You're probably thinking, why Franchise Benefit Solutions? What's the advantage of your program over other programs? Or what if I looked at a similar plans on my own? Well, we offer exclusive group plans and rates, all with guaranteed acceptance and no waiting periods. Our plans and rates are the same no matter where your franchise is located. If you have a franchise in Florida, Michigan, Washington, or California, the plans and rates are the same. We don't require employer participation or contribution. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. You choose the benefits you want to offer your employees, and your employees enroll online through our online portal. Our products portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Again, plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. Our benefits program includes 3 medical options: individual and family, comprehensive group, and voluntary group plans. For those franchisees that don't want to offer a group plan for their employees but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. If a franchisee is considering their group plan options, we can help them make the right decision that best meets their healthcare needs of their business and their employees. Group plans are based on the demographics of their company, along with their employee and dependent ages. We would need census information in order to provide them with a group plan proposal. Our third and most popular option is our low-cost voluntary group medical plans, similar to an association health plan. The plans are the perfect strategy for franchisees focused on cost containment, usable daily benefits, and compliance with ACA mandates. The WellCare plan covers preventative services only, while the Elite Care plan covers preventative services, primary care and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. The IHP plans provides more comprehensive coverage, such as in and outpatient hospitalization, emergency room, diagnostic testing, maternity, home health care, chemical dependency, and prescription drugs. Again, the first 2 plans, the WellCare and the Elite Care, the WellCare covers wellness exams only, which would include anything to do with a preventative care physical exam. That could include the exam, any type of testing, blood tests, any type of testing such as mammography or colonoscopy. Again, 100% covered. Elite Care includes 100% routine preventative coverage, primary care office visit at a copay, specialist at a copay, urgent care, lab and test, lab and x-ray, also with a simple copay. And then at the bottom there, pharmaceutical prescription drugs, generic coverage. IHP core plans, the core and the prime, includes, which is similar to a comprehensive group plan, includes more coverage, such as the diagnostic testing, inpatient, outpatient services, emergency room, diagnostic testing. You'll notice at the bottom, it says benefit subject to reference-based pricing, and you'll notice the some of the coverages will have the benefit reference based pricing. What that means is it is subject to Medicare payment. It'll pay up to 200% of what Medicare would pay, and the hospital or inpatient, outpatient services, as long as the facility or the hospital accepts Medicare reimbursement, then the plan is acceptable. We've been selling this plan for 2 years now, and we have not had any issues with this type of plan. We also offer a dental plan. We offer 3 plans, 3 PPO plans through MetLife. Plan 3 and 4 are the same, except that, and what I mean by the same is the benefit maximum is $1,000. The only difference is plan 3 does not include orthodontia, whereas plan 4 does include orthodontia. Plan 5 benefit maximum is $2,000. Same as plan 4. The benefit maximum is up to $2,000. On all 3 plans, the preventative services are covered at 100%. Basic services covered at 80%. Major services at 50%. And like I said, for orthodontia, plan 4 covered at 50%. For those of you that may be in California, we also offer a HMO dental plan through Delta Dental. The plans are simple copays. There is no deductible. You pay simple copays such as office visit $5, preventative services covered at 100%, restorative services, crowns, endodontics, periodontics. As you can see, you just pay a simple copay and then it's covered at 100%. Again, it is an HMO program, so you would have to see a Delta Dental HMO provider. Our vision plan is administered through MetLife, but it is a VSP program. We offer 2 plans. The first plan is a 1224, which means eye exam is a $10 copay once every 12 months. Lens frames or glasses, a $25 copay once every 24 months. You could, the copay is towards glasses or contacts. The glass allowance is $130. Contact fitting and evaluation is a $60 copay. Retinal imaging, a $39 copay, and the laser vision or LASIK is a discount. Plan 1212 is similar to the 1224, except that the glasses, lens frames, or contact lenses once a year instead of every 2 years. So again, the plans are similar, but the 1212 is once a year versus the 1224 is once every 2 years for the glasses or contacts. The program also includes retail change providers such as Costco, Vision Works, or Sam's Club. Life insurance, we offer 2 options. The first is an employer pay group life AD&D plan of $10,000. The second life plan is employee pay, not employer pay. It allows employee to select up to $150,000 or 5 times their annual income. You can also select spouse coverage, which would be 50% of the employee amount up to $50,000, and you can also select up to $10,000 for dependent children. Evidence of insurability is not required when you're first eligible. if you happen to want to enroll in voluntary life after the initial enrollment, then you will have to answer health questions. For 2024, we're going to offer a new virtual primary care and telemedicine program. Virtual primary care is the same as if you were going to your own doctor. However, virtual primary care means that it's virtual. So the program offers primary care physicians to provide personalized care through the phone and video interactions, no matter where you're located. Patients will receive a lab or genomic testing, which would be shipped to your doorsteps. You would collect blood sample and then mail the lab in a prepaid package from your home. And then the preventative approach that includes at-home labs and risk satisfaction enables early intervention to improve patient experience and outcome. So basically, you select your own primary care. So anytime you needed to speak to your doctor, you have your own primary care. It includes annual wellness exam, health risk assessment, again, screening lab, review and recommendation, follow-up visits, ongoing support, chronic condition management, post-visit, lab ordering and review, and specialist coordination. Again, as if you're going to see your primary care physician, except this is a virtual program. It also includes electronic prescription ordering, integrated urgent care. So if you needed to speak to a doctor other than your own primary care, similar to the telemedicine plan. It also includes therapy and counseling services from social worker and psychologists, psychiatric care. This is one of the advantages that we decided to go with this type of program, is we've been receiving calls if our program includes psychiatric and behavior health management program. It also includes an on-demand counseling, virtual consultations, 8 face-to-face referrals with a licensed behavior clinician. And finally, it also includes a prescription benefit where it's zero copay, and it does include a broad prescription list. Our telemedicine program is simple. If you need to see your doctor, or if you need to see a doctor, but you're not able to go to the doctor's office, you call in, provide the doctor with your symptoms. They'll provide you with a diagnosis, and they'll even call in a prescription. And the program for 2024 will also include the behavior health. Hospital confinement program, you have a choice of 2 benefit options, the Pro plan and the Master plan. Benefits cover both injuries and sickness. Benefits are paid for inpatient and outpatient medical treatment received in a hospital, emergency room, and physician's office. This type of hospital confinement is a good package to include with the voluntary medical plan. Additional benefits include surgery and anesthesia services, diagnostic exams, pregnancy, and lodging. So again, this is a good, perfect program to add to the voluntary medical program. Accident covers additional accidental injury regardless of any other insurance. Remember, the hospital plan covers any type of hospitalization or in the doctor's office. This plan here is accident only. Benefits cover both inpatient, outpatient treatment. It does include more than 50 benefits, which includes hospital admission, hospital confinement, ambulance, emergency room treatment. In addition to the inpatient and outpatient treatment, it also includes a lump sum payment if you happen to have a fracture or dislocation. So in addition to the hospital and treatment benefits, you can see the fracture lump sum payment for, let's say, a hip or a thigh. It'll pay an additional $5,000 if you happen to have a fracture. Dislocation, let's say you dislocated your knee, it'll pay a lump sum of $2,500. Our benefits enrollment platform includes 4 steps from the initial contact through the employee enrollment process, identifying the employer's objectives, reviewing their benefit options, providing easy to understand benefits communication, and optimizing the enrollment process through our integrated portal. So again, from step 1, which is the initial contact, where we identify your objectives, determine what your budget is, and we'll gather some information if need be. Once we gather the information, well, if we need to, we'll obtain quotes from our carriers. We'll present the benefit options to you, and then we'll also formulate a benefits plan with your help. Step 3 will provide you with easy to understand communication that you could distribute to your employees, and we'll also build out an online enrollment platform, which moves to step 4, which ties the employee communication to our online enrollment system. Once we receive information from you, we will set up the online enrollment. How it works is either at the time of orientation, or let's say the initial enrollment process, you as the employer will send employee login email, or we will initially send it out to your employees. The employee would create a password and complete their registration. They will then verify personal information, add dependent information, and then they will begin the step-by-step enrollment process. They will need, for each benefit, they will need to choose their coverage level. They will need to either enroll or waive, one or the other. They will continue until the enrollment is complete. Once their enrollment's complete, they will review their benefit summary and then e-sign their enrollment form. If they do not receive notice to e-sign their enrollment form, that means they missed one of the benefits or coverage levels that they need to either enroll or waive, and they will have to go back and take care of that. Then once they're done, then the benefits are integrated with our insurance carriers, and we will know that they have completed their enrollment process. Turning to the employer mandate under the Affordable Care Act. As most of you know, the individual mandate no longer exists. In most states, individuals are not penalized for not having health coverage. The employer mandate, however, remains in place, and don't expect it to be replaced anytime soon. Here are a few key provisions of the ACA and how it will affect you. A full-time employee is an employee that works at least 30 hours. Benefit waiting periods must be 90 days or less. Employer with less than 50 full-time equivalent employees are not penalized for not providing health insurance. So again, if you have less than 50 employees, you do not have to offer insurance and you're not penalized. However, if you have more than 50 full-time equivalent employees, you must provide health insurance or you will be required to pay a penalty. So again, when we're first speaking with you, we will discuss the Affordable Care Act and what you need to know. A lot of employers, they may say that their full-time employees 40 hours. However, under the Affordable Care Act, a full-time employee is an employee that works at least 30 hours. Looking ahead to 2024, there's a little known requirement under the ACA, which requires health insurance insurers to offer an annual 1-month special enrollment period from November 15th through December 15th to employers in the small group market who do not meet the employee minimum participation or employer minimum contribution requirements. Many insurance brokers do not know about this requirement, and insurance carriers do not want you to know about this. Under normal underwriting, insurance requires at least 50% of eligible employees to enroll. Under the special enrollment period, 2 full-time employees must enroll. Just so you know, under the ACA, husband and wife are considered as one employee. So again, this is probably the busiest time of the year for us. This is what we call our accounting season. November 15th, which I think is next week, from November 15th through December 15th, you can enroll in a group plan, a comprehensive group plan, without any type of participation or contribution requirements. Again, if during the year you have 10 employees, then under normal underwriting, the carrier is going to require 50% of eligible employee participation. Under the special enrollment period, we only need 2 W-2 full-time active employees. So we find it could be maybe the owner and let's say the general manager. So as long as we have 2 enrolled, then you're good to have a comprehensive group plan. So what are the most popular solutions to help you hire and retain employees? I've outlined 4 packages here that we find to be the most packages that the employers or franchisees will select. Package 1, the employer offers a dual voluntary medical plan and contribute towards the employee-only cost. The employee contributes the balance of the employee cost plus dependent cost and any buyout plan. The employer offers voluntary benefits at 100% employee pay. So basically, the employer is going to offer the voluntary medical plan. He may or may not contribute towards the program, and then the employee would has the option of selecting the voluntary benefits. Package 2, the employer enrolls in a management-only group health plan through the special enrollment period. That was the November 15th through December 15th, whereas the employer may contribute for ownership themselves. They'll contribute 100%. For management, maybe 50%, and non-management, they would not contribute at all. And then the employer would offer the voluntary benefits at 100% pay. Package 3, the employer enrolls in a comprehensive group health plan where they will offer dual medical option and contribute 50% of the employee cost of the lowest plan. The employee then would contribute the balance of the employee cost plan, dependent costs, and any buyout. And then the employer would offer the voluntary benefits at 100% employee pay. And then package 4, which is actually becoming our package 1 or package 2, the employer can offer the voluntary benefits to all employees at 100% employee pay. The employer does not contribute at all. So again, our package, the employer selects the programs, decides what if he wants to contribute, and then offer the voluntary benefits at 100% employee pay. So let's take just an example of a cost breakdown. Whereas step 1, the employer sets up a class of employees based on the job title. Could be ownership, class 1, class 2 would be management employee, and class 3 would be non-management employee. Step 2, the employer sets up a comprehensive group health plan for ownership and management level employees. The employer contributes 100% for ownership and 50% for management employee. Step 3, the employer sets up a voluntary medical plan for non-management employees at 100% employee pay. Again, as you can tell, there's 3 steps, 3 different levels that the employer can set up and contribute if he wants to. And step 4, the employer offers additional voluntary benefits to all employees at 100% employee pay. And that includes the hospital confinement, dental, vision, voluntary life, telemedicine, and accident plans. Looking at some of the example monthly cost, let's say you're an owner at age 55, you could look at a United Healthcare plan, a PPO plan with a 2,000 deductible, 80/20 coinsurance, $40 copay for primary care, $50 copay for urgent care, and $15 copay for prescriptions. A monthly cost could be $885. Obviously, the employer is going to contribute the full $885. For the management employee, let's say age 47, again, sets up another United Healthcare plan, PPO plan, but instead of a 2,000 deductible, he has a $5,000 deductible. Coinsurance remains the same, $40 copay primary care copay, $50 copay for urgent care, and $15 prescription drug card. Monthly cost here with a 5,000 deductible is $657. Here, the employer would contribute 50%, which would be $328 for the employer contribution and the same for the employee contribution. And then for the non-management employee, let's just say age 35, through the voluntary medical plan, which would be a $15 primary care copay, $50 urgent care, and $15 prescription drug card. Monthly cost, example, $118. The employer does not contribute towards it, whereas the employee contributes 100%. So as you can see, this is again example. We would help you set up the program. You set up the class, different classes if you want. You design your own program, and we will help you set it up. Now we've come to the end of the webinar, leaving the questions. Let's see here. Do we have any questions? Here's my contact information. I'm not able to pull up, I'm not able to pull up if there's any questions here.
Yeah, I don't see any questions in the Q&A, Bernard.
You don't see any?
No, sir.
Okay. Well, here's our contact information. Again, like Josh mentioned, we will get out the recorded webinar here. We'll also include our employer's guide, so you can review it. If you have any questions, you'll be able to schedule a time to talk to us, and then we will work with you on setting up the program. I do see a question that.
Yep, Krista just popped one up.
Go ahead.
It says, will the defendant be on the insurance card? Maybe she means, will the dependent be on the insurance card? Yeah, probably.
Do you know, generally it would be the employee that would, or the primary policyholder that would be on the insurance card. It really depends on which carrier. Some of the carriers will include the employee. You will have your own, employees will have their own portal that they'll be able to go on, they'll be able to set up, register, and they'll be able to pull dependent information or whatever their need from the insurance carrier. Any other questions?
Nope, I don't see anything else.
Okay.
I want to give Krista just another minute just to make sure she doesn't have a follow-up. Yep, not seeing anything.
Okay. Again.
But here we go. How can I see the money coming out of She probably means basically how does the money move from if we're doing some from her account. So if we're doing an employee contribution and the owner is and the business is covering or participating in part of the cost coverage, how does that money movement work when it comes to what the business would be paying for and then what the employee would be paying for, or if the employee is paying 50% of something. So that's I think that's a kind of what she's getting at, because one of my questions.
Get it. I get it. Basically from our enrollment portal, you're able to download reports would be one way. The other way would be an integration from your payroll service through our enrollment portal. There is a cost to it. I'm not sure if it's going to be in 2024 or 2025. Our enrollment portal will be could be integrated with your payroll vendor. But in the meantime, if you do not want to go that route, you can download the payroll report from the enrollment portal and forward it over to your payroll vendor, and then they will deduct the payroll contribution or the employee contribution from their pay. We will send you one invoice for the group benefit, and then you would pay us, but the employee contribution would be deducted from your payroll provider will handle that end of it. Hopefully that answers your question.
So just to confirm on that, Bernard, so anything that the business is paying for would be billed directly by Franchise Benefit Solutions, and you would draft our account for that. And anything on the employee contribution side, if we're asking the employee to pay for 50% of part of the policy, that would be deducted from their paycheck.
Correct.
Okay. And then she says, where in the report will it give a breakdown?
The payroll, it'll give you a total. There's a few different reports. One report is a open enrollment summary, which outlines each employee, what their selections are, what their or it'll provide you with a summary of each employee's selections and their deductions. Another report is an actual payroll deduction report, which shows what each benefit, the amount, and what the total amount should be deducted. That's the report that you would forward over to your payroll vendor. And again, if you have any questions on it, just reach out to us and we'll help you on it.
He said that's all she needs.
Perfect. Well, again, with no other questions, if you do, my contact info is on the screen. We'll get out a recording, a link to schedule a call with us, and the employer guide. So, Josh, I want to thank you for helping us out on this. I hope everyone has a good rest of the day. Josh, if you want to, any final comments?
No, I think this is great. I certainly appreciate you all taking the time to put together a good package for all of us. And I do think that this hopefully fills a gap that we've had, for quite some time in our system about being able to provide these benefits to our employees. So I hope that we take advantage of it. And I appreciate you all taking the time to give us all this information. And I'm sure you'll be hearing from some of the owners here soon.
Okay. Thank you, everyone, and have a good rest of your day.
Thanks, Bernard.